plan has for the laboratory workforce at the end of the 5 years period, I have extracted. It says develop and implement comprehensive human resource for health plans based on health needs, taking into account current stock, demand, supplies, skill mix, and distribution in public and private sectors, as well as local and global markets. Scale up training and the development of health professionals in line with staffing requirement. Maintain and improve competence of the health workforce through effective, efficient, and sustainable continuing professional development. Institutionalizing mechanism for staff motivation and retention, as related now to the topic, as you can see. Appropriate planning and implementation of in-service and pre-service trainings, very critical also for the motivation and retention. Standardized premises, processes, and practices to ensure safety of healthcare providers and minimize risk and harm to patients. This is our curricula for laboratory workforce development training. Basic theoretical knowledge and practical skills, are they really adequately provided? Availability and adequacy of laboratory equipment for hands-on training and practices, do we have that? These are very, very important questions we need to address in this panel, because there are people also here who are authoritative to talk about that. We have the plan to undertake, as well as do we have the standardized modules and training package for in-service trainings? These are the questions we need to handle here. And what are also the professional associations doing? The laboratory profession, are they also contributing towards? Because the workforce, laboratory workforce, is the most important asset of the laboratory system. We have to make sure that our workforce, our personnel, are safe and working in a lean system. So in that respect, I just raised a few items here. Conducive and safe laboratory working environment, that also medical surveillance for our laboratory workforce. Do we have them? Do we have a system to ensure that? These are the questions we need to answer, also discuss here. Do we have appropriate technologies and standard operating procedures in place to safeguard laboratory personnel? Do we have adequate laboratory biosafety cabinet systems in the country where they are appropriate to be found? These are critical issues, again, to address. Laboratory biosafety and biosecurity programs implemented, resource allocated, also planned for. These are the issues we need to address as well. In the area of motivation, which is the difficult part of everything, and retention, I will list at least factors which I consider are critical and very important to motivate people and to stay where they are and working. First, I really emphasize conducive work environment, standard equipment, availability of standard equipment for the laboratory work practice, adequate supplies, consistently available, no interruption, management support, management understanding, recognition of the laboratory as an important critical component of the health system itself. There are many issues there to satisfy, to motivate laboratory workforce and laboratory professionals to stay, to be motivated and engage themselves also in the promotion of their profession. Implementation of standards for quality practice is a motivating factor for me. Does the laboratory have a vision, workers? Recognition and attention. Training opportunities for competency improvement and career development. Clear organizational structure in the organization itself. Is the laboratory recognized, given the right place, given the right attention, given the right resource? Are they supported also as they go along in the implementation of their activities? Do we have functional lab-clinic interface? An harmonized one, very nice communication, result recognized, profession acknowledged, contribution acknowledged? Do we have that system in place? Or laboratory and the rest departments are working in silos? This is very, very, very critical, and that motivates for me. And then management readiness to entrust additional roles and responsibilities to the laboratory workforce. People who are given the trust and the responsibility are confident, are motivated. These are the environment we need to establish so that these are there. Implement strategies for retention. In fact, these are the factors in the strategy itself. I know I have missed one thing which everybody is looking at, but I will answer it later on. Thank you very much.
Thank you, Mr. Gonfa, for just actually spending some few minutes. So basically what has been said is just how should there be a mechanism in which to motivate and retain a workforce within the laboratory at every level. And Mr. Gonfa has indicated that actually the indication is in the form of question. Probably just because laboratory safety is concerned, is there any standardized design at national level? Is there any space which is actually suitable for the lab to be worked in? And then the other facilities like the power supply, uninterrupted water supply, storage system, and stuff like that. And also other mechanisms of retention and motivation, like vision of that specific institution, which means that of the lab. And there's just, is there any clear job description for the personnel to work on? And also, is there any clear career path and other stuff as well? So having said that, next the presenter will be Dr. Katie, sorry if I mispronounce it, Dr. Catherine Robstein, and she is an assistant professor. So she will be talking on the role of medical laboratory science educator in meeting sustainable development goals. Dr. Robinson is PhD candidate actually in health care administration from Central Michigan University, and she received her undergraduate degree in the University of Southern Mississippi in medical technology with minor in chemistry. Her primary expertise is in international medical laboratory science education. In her dissertation, which is entitled Critical Success Factors Shaped by Medical Laboratories Earning International Accreditation, discusses the factors these laboratories have overcome to earn recognition for being quality laboratory. And Professor Robinson served as International Technical Training Manager for the ASCP, is to say American Society of Clinical Pathology, Center for Global Health from 2006 to 2016. And in this capacity, she collaborated with CDC, Ministry of Health, lab directors and EMLA educators in over 23 countries to design workshops, mentors, assessments, and seminars tailored to meet country-specific needs. She began a program in 2011 and subsequently developed a pre-service LIMTA program for using strengthening the medical laboratory science curriculum and enhancing just facility didactic and practical lessons related to quality management systems. And there are also others which we can't actually cover at this time. So may I call upon Dr. Katie just to present the preparation. Thank you very much.
I am proud that I have been a member of EMLA since 2006, courtesy of Dr. Ms. Steele-Wold. And this past fall, I became a lifelong member of EMLA. So, I'm going to continue Dr. Ayaya's presentation because now I am going to look at the role of the medical lab scientist educator in meeting the Sustainable Development Goals. Now I'm going to define MSL educator, and that's going to include everyone in this audience, whether you are an educator at a university, or whether you are a preceptor at a hospital lab, or whether you are a staff at a hospital lab. You are a mentor and you are impacting students and peers. Okay. I think I need to set the Sustainable Development Goals. They followed the Millennium Development Goals, which ended in 2015, and so now we have the Sustainable Goals that run from 2016 to 2030. We're going to talk about medical lab science faculty and the role that they play. We are going to discuss the pathway in Ethiopia that your MLS education has taken. We're going to look from 2006, when I first came to your beautiful country, to now, 2016, and we're going to look at how much progress you have made because you have worked together and you have been motivated to make a difference in the healthcare system in Ethiopia. Okay? So, the Sustainable Development Goals. There are 17 of them, up a lot, almost double from the Millennial Goals. So the ones that are in red, goal number 3, good health, 4, quality education, 9, innovation infrastructure, 11, sustainable resources and communities, and partnerships for the goals, number 17. Those are the specific goals that all of you are helping to implement. Okay? So first, in 2003, PEPFAR was formed, and it was the global response to HIV/AIDS. So first, what do we have to do? We have to develop or establish baseline readiness. What are we capable of doing? So we did that in Ethiopia. And we decided initially in-service training was the most critical need to train the laboratorians currently working so that they were familiar with automation and how to report out accurate and reliable tests so that the clinicians could make accurate and reliable diagnosis and make treatment plans that would be helpful to their patients. Okay? Oh, wait a minute. I'm sorry, go back. So, together, the goal was accurate identification and diagnosis. Okay. So I do have some pictures that I felt I should share. So this was the first training that I attended at INRI, and yes, I'm using the acronym before the change. Okay, go on. Thank you. And so there's my picture, okay. And so here is another picture of the workshop that we held. And there actually on the right is me teaching quality control and Levy-Jennings charts, okay. And of course we all learned what the inside of automated analyzers looked like. And we all learned how to start troubleshooting to determine when something was wrong. So initial challenges. Initially, we found little to no inter or intra-lab infrastructure. We didn't see dedicated electricity and water sources. No standardization of automated equipment. Little to no knowledge of quality management systems. Minimum staff and patient safety processes. And maybe the most important is that the clinicians were not accustomed to using our services, our information. Okay, so this is what, the first time I visited the regional laboratory, this is what I saw. Okay? So, What has happened? You have now become more standardized with your equipment. What does that mean? That means if you have all the same hematology analyzers, you have an increased voice in negotiation power. So you can now say, we want 20, 30 of these hematology analyzers, and this is the price we can pay. So you have gained confidence, you have gained knowledge in how to negotiate for your needs. Supply chain management. You are now using a common formula for determining your stock needs. You are monitoring your stock. You are documenting. Remember, we've all learned, if it's not documented, it's not done. You are now more familiar with quality assurance and quality control. You know what calibrators are. You know what controls are. Everyone's familiar with SOPs and how to write them. Everyone knows that a piece of equipment has to have a book of life when it's installed. You know about Levy-Jennings charts and what to do with them. IQC and EQA protocols. And I think I keep mentioning accountability. You know that that is your responsibility in the laboratory. Okay? So the thought process evolved, both globally and in Ethiopia. So now we know the model for improvement. What are we trying to accomplish? How will we know if what we've done is an improvement? And what changes can we make that will result in improvement? So we're doing the PDCA cycle. Everyone raise your hand because I know you're familiar with the PDCA cycle. Yes? 2, 3, come on, I know you are. Good, thank you, thank you. Okay, so now we go on to the quality management systems and the SLMTA principle. And yes, Dr. Gonfa and I were in the same SLMTA training class in South Africa. And SLMTA labs have made a big difference, the SLMTA initiative. 18 months or more is the minimum for laboratories to become knowledgeable and to implement quality management system principles into their laboratories. So the laboratories are improving. They are implementing these good practices. We also have the SLMTA checklist that helps you to measure. So it's not too helpful if you know if you think you're doing something well, but you can't measure it. So now you've got both the new practices and a measurement tool. Okay? And so this is the SLMTA process. And so your labs are moving ahead. Your administrators at your hospitals are starting to see the lab. And they're saying, oh, the lab is doing this. Now they're not running out of stock. Their turnaround times are decreased. They're meeting the clinician's needs. They're concerned about clinician satisfaction, patient satisfaction, safety. So the administrators are noticing. As clinicians, as nurses, as other professionals attend some of these workshops and continuing education courses, they're learning. So now the laboratory is not an obscure department. Now the laboratory is setting the standards for quality. So the next question is, now that the labs have this new ability, is the curriculum preparing graduates to meet the new labs? So there was a lot of discussion, and pre-service was born, which means we're looking at the curriculum in the universities in Ethiopia to make sure they are preparing the new graduates for entry-level positions. So next, pre-service is introduced. So this brings faculty and laboratorians together so that they can focus on the graduate knowledge and the competency needs for labs positions. What does this do? This builds capacity and it builds sustainability. Together, they reviewed the current curriculum to identify knowledge and competency gaps in the curriculum. They then developed courses and materials to fill those gaps. They practice integrating international best teaching methodologies into their lecture and practical lessons. We met with Dr. Esther and many of you in the room in Adama to work on building the curriculum. We had representatives from each of the universities and some hospitals that we worked in clinical chemistry, we worked in hematology, immunohematology, parasitology, microbiology, virology, molecular, and all of these different areas. It was long days, and it was hot, but it was a lot of work, it was a lot of fun. And then each discipline would come up in front and say, this is what we need to do in hematology to prepare the students. Or this is what we need to do in clinical chemistry. Okay? So, you may recognize yourself in this picture. Okay? So, we have interaction between university faculty and the laboratory professionals. So we're building internal partnerships because who best knows the needs of our students? So they agreed on objectives and outcomes to prepare the students to fulfill the entry-level positions in SLMTA laboratories. They did a lot of research to make sure that the materials they were developing were the right materials to prepare their students. The team and consensus building was incredible to be a part of and to observe. This is my favorite picture, I think, from Ethiopia. It's on a beautiful frame on my desk. So I keep fond memories of Ethiopia close at hand. Okay? So, 1 to 2 week workshops with outside partners to complete the revision of curriculum. Once the curriculum was written, then we had to go through the approval process. And it's not a simple one-day process. It's very time-consuming. But Ethiopia did that. They went through the processes and they gained approval from the Ministry of Health and Ministry of Education. So then we had to, as a faculty, across all the universities. So what is maybe as important as the developer is revising the curriculum is making sure that there's continuing education for your faculty. The topics that were included were to learn that students have different learning styles, and you have to adjust your teaching to be able to reach all the different types of learners that you have in your class. We learned the characteristics of effective teachers, how you can improve your teaching methods yourself. You learned to write measurable objectives. You developed clarity in writing test questions. You learned about objective grading standards. You learned about effective communication between your students, between your peers, and between others in the medical setting. You applied interactive teaching methodologies, and you provided a time for your faculty to gain the confidence and the ability to implement these new technologies. Okay? So, we roll forward to last fall when, and I was working with ASCP at the time, when we were asked to help facilitate a workshop between laboratory preceptors and laboratory faculty to improve the evaluation form of students in their clinical practice. This was an incredible workshop, as all the workshops that I've participated with in Ethiopia. But the team, the groups, the preceptors and the faculty came together and they talked about what each needs were. What did the preceptors need to successfully train the students for practical application? What did the faculty need to do to prepare the students to be successful in the laboratory attachment? There was a lot of listening. Listening is important. They came together, they agreed upon a plan, they formed a work group, and they have been working ever since to come together with the best way to implement the standardization of evaluation so that it's objective, so that all of the graduates are equally prepared to take on these entry-level positions. So we have some pictures from this workshop. And then challenges overcome. And Dr. Gonfa mentioned this. You had to overall increased laboratory staff turnover after completion of the SLMTA program. You had to gain administration and lab staff buy-in. One person can't make the change alone. You worked with supply chain procurement issues, collaboration. You're moving the lab from obscurity into the limelight of your hospitals, and you're setting the standards for quality in the hospital setting. So successes achieved. You have all learned to collaborate together. The faculty have gained knowledge and skills through the continuing education workshops. The same with in service, the same with the staff. There needs to be more standardization in the continuing education. Hospital staff are invited to participate in designing the internship evaluation form. The more input, you have a 360-degree view and perspective on how to best educate your students. Both of the groups, the educators and the laboratorians, I think have a much better appreciation of each other's role and how they can work together to support each other. And they do know that both of the groups have the same goal, and that is to build capacity and sustainability of efficient laboratory services. So we have our collaboration. And then, so how have we done, how have you done in meeting the Sustainable Development Goals? Goal number 3 is good health. Quality laboratory systems do impact health. So you're working on goal number 3. Goal number 4 is quality education. It helps build capacity and promote sustainability. You are setting standardization in your schools. Is this a one-time thing? Once you have it, is it complete? No. Change is the only constant in all professions, but especially in the laboratory profession. New technologies, new testing, new everything occurs almost daily. So we have to keep going back and keep reviewing and keep revising. Sustainable goal number 9, innovation in infrastructure. You're setting standards. The laboratory has done that. Now other departments are starting to look at the laboratory model, and they're starting to implement quality. Better specimen collection methods. I love BD. They're out there. They have all the safety equipment now so that you can prevent needle stick injuries. You can obtain quality specimens from your patients, because then the lab can report out quality results. Number 11 on the sustainable goals, the sustainable resources and communities. If we have standardized and quality laboratory services, and we have a continual supply of qualified entry-level graduates, then we are going to be able to sustain the resources, and we're going to be able to maximize healthcare in our communities, in our cities. And number 17, partnerships for the goals. You already are working together for a better Ethiopia. You have internal and you have external, and both partnerships are equally important and equally viable. And then I have to show, when we first started coming, we would be treated to Ethiopian culture and Ethiopian dances, and it was just fabulous. And then I would be remiss next if I did not say that I am standing up here to talk with you today, but I've had so many consultants that I've worked with and that you have worked with. So I have to say hi from Wendy Arneson, from Berthina Lachow, from Marion Kavanaugh, from Pat Ellinger. Pat said, ask them if they remember my blood bank workshop in 2013. All of the consultants are with me in spirit, and they are very proud and happy to have been a part of working with Ethiopia and to see the progress that you have made. Are you finished? No, we're never any of us finished. We continue to improve. We continue to set new goals, and you are doing that. So, the future of lab services, I love this African quote. If you want to go fast, go alone. If you want to go far, go together. So, and look at you, look at what you have done. Look at the leadership that you have. You have researchers, you have leaders, you have educators, you have speakers, writers, publishers. Your role is to continue what you are doing to meet the sustainable goals. 5 out of 17 are direct impact. There are 3 others that are indirect impact. You are doing a good job. You should be proud of yourselves. You are the positive force to unite community trust in the Ethiopian medical system. Labs are vital. Medical laboratory scientists are valuable. Educators are valuable. Laboratory staff are vital. Thank you very much.
That of the quality management, curriculum standardization, and then illustrating the in-service training, and also about continuing education for the faculty, sustainable development goals, numbers 3, 4, 9, 11, and 17. And at the end, actually she took a proverb which is very much powerful, in which she said, if you want to go fast, go alone. If you want to go far, go together. So I hope we will choose the later one. So thank you very much for your presentation. I hope you will come back to queries and questions later on. So just to be more democratic, just I will give a chance to my co-chair to introduce the next presenter. Mr. Kasu, please.
Thank you, Dr. Gameda. The next presenter will be Ms. Mastwal Karope. Are you around? Okay. I think it is changed to the next presenter. The next presentation will be presented by Dr. Brahanu Siyu. He is going to present on the topic boosting medical laboratory service integration into the healthcare management system through quality education. I think this may go in line with Mr. Gomfa presentation as well as Dr. Catherine. Dr. Brahanu, he has been working as on research, probably, if I am not mistaken, on molecular characterization of tuberculosis along with other public health issues. Currently, he is working as an associate professor at the same university, at Alamaya University. So Dr. Brahanu, he has a lot of publications. If I'm not mistaken, he has more than 15 publications in peer-reviewed journals. He can make a correction because I didn't get his CV. That's why I'm mentioning as a colleague. Okay, so you are given 15 minutes. Thank you very much.
Okay.
እንደምን ዋላችሁ እንደምን አደራችሁ ይቻላል። Okay, good morning, dear our respected guests and also colleagues and members of our association. Thank you, Kasu, for your kind words and introduction. As Kasu clearly indicated, I'm going to present for you in the coming 15 minutes, entitling on the boosting laboratory service integration into healthcare systems and quality education. In fact, it is very difficult to talk after seniors, when seniors are talk lots, so the juniors may lack words to say anything. So there is no problem, and I do have seniors behind me, and if I made a mistake, my mentors, like Gash Gomfa, can correct me. Thank you, and then I will start my presentation. So this presentation almost in line with what has been said by both the presenter, Gash Gomfa touched some of the points, and also the second presenter also talked some issues in relation to my presentation. So my outline of presentation is there is some sort of introduction, key function, integration of lab service, role of research in improving lab service, quality education, challenge in quality of education, and eventually I do have some points about conclusion. So I think we all know, even during the morning, the guest from the Federal Ministry of Health gave us a very enlightening speech concerning about the role of laboratories, especially in the healthcare system. Therefore, lab services are an essential element in the healthcare delivery system. But as a consequence, in the last 2 or 3 decades, even in the last 2 decades, I count technologies, significant growth in molecular and genetic testing, fingerprinting, stem cell research. We can talk lots. Increased demand for point-of-care testing. One of the very issues that the health professionals are being trained in to provide quality health services. As a result, the laboratory professionals also take the central role in provision of quality of service to the individuals or the community. As a consequence, we need to have point-of-care testing, even testing that people should not come to you to find the results. You can send results online. You can share data along university hospitals, even specialized hospitals, health centers, so forth. However, even though there is a swift development in the lab services or the profession, still there are challenges. Lab services are often given still less attention, particularly in low-income countries. It's not that they don't want to have a quality service. It is due to particularly lack of resources. But in the morning, I was so much delighted when Dr. Daniel was talking about the future of laboratory in this country, especially in Ethiopia. So lots are expected to do so. So what are the key functions? As we know, practice of modern medicine would be impossible without testing performed in the med lab. As a consequence, up to 70% of clinical decisions are influenced by data generated from the laboratory. That's why that we are always shouting, discussing about the quality of laboratory services. Whatever the health infrastructures that we have, if we don't have very strong laboratories with very qualified, competent health professionals, lab professionals, that is the end of the story. So the key functions include diagnosis of communicable and non-communicable diseases. Even in Ethiopia, if you see the trend of non-communicable diseases, now it is increasing at an alarming rate. Therefore, we, the professionals, we do have lots of responsibilities even to play in that sector as well. Characterization of microorganisms, epidemiologic surveillance and epidemic investigation, conducting or coordinating lab service of infectious diseases, environmental surveillance, water, air, heavy metals. Nowadays, there is a massification of industries. So there are waste products that are being released to the environment. So those products has to be environmentally friendly. Are they? So those has to be checked through the lab services. Emergency preparedness and response, natural disasters, emergency diseases. A case in point is Ebola. So there are emerging and re-emerging organisms, diseases that cause challenge to the human disease. Therefore, laboratory can play a pivotal role here also. Evidence-based research. So if you want to make decisions, that decision has to be supported by evidence. Therefore, laboratories are also in a position to produce evidence-based data. So by discharging these functions, lab services are integrated with wider healthcare system. So laboratory is one of the segment, one of the health packages of the health delivery system. Therefore, we have to work in a very hand and glove manner with the other health sectors in order to provide quality health service. So lab service provide valuable input in clinicians and public health managers in planning, implementing, and also evaluating all the interventions. So I think these are also touched by Gonfa, but as a passing remark, I also tried to extract from the health sector transformation plan of Ethiopia for the coming 20 years. It says from 2016 to 2019, no, 2019 to 2020. So in that, it is clearly indicated that the government of Ethiopia is very much committed to transform the laboratory service in the country, particularly in the area of prevention and control of major diseases.